of my areas of specialty is Parkinson's disease, and today I'm hoping to expand a little bit of your knowledge base about this disease. A few of the things that I would like to accomplish today as far as objectives are to define what speech pathology is, and to identify the changes that occur with speech, cognition, and swallowing during the course of this disease. I'd like to discuss the effects Parkinson's has on an individual, review some treatment strategies that I use, and explain two evidence-based voice therapy programs that we have available, and also provide some strategies for coping with Parkinson's. So the reason I have a definition of speech pathology is because a lot of times patients arrive in my office and they're kind of confused as to why they're being referred for speech therapy, because they associate it with just not being able to say certain sounds correctly. So in fact, our practice actually focuses on assisting individuals that are experiencing any sort of communication, cognitive, or swallowing difficulties. And this area of rehab is heavily rooted in the theory of neuroplasticity, which simply put is the brain's ability to learn information, to learn actually new information, and to increase that area of the brain that is experiencing deficits. So we all know that Parkinson's disease is a progressive neurological disorder, and I always refer to it as being kind of sneaky because it actually progresses in a gradual manner. So often the disease has been progressing for a period of time before we're actually diagnosed by our neurologist. But there are some changes that individuals experience with Parkinson's that are hallmark to the disease. First of all is there's usually a change in voice, and what can happen is the voice becomes softer. And that's because the vocal cords are not coming together tightly because of lack of functioning from the diaphragm. Speech can also become less precise and slurred, and that's primarily due to the decrease in strength with the tongue and the lips. Occasionally, we will see a patient that is presenting with speech problems because they're speaking actually too quickly, and that's not necessarily a deficit with regard to the musculature. It's actually more of a motor speech planning issue. Parkinson's can also affect language and cognition and can cause word finding deficits where you're going to feel like the word is on the tip of your tongue. Thought organization problems where you have difficulty linking your thoughts together and putting the words together to express yourself. Processing skills, so that we're having difficulty understanding and decoding what is actually being said during conversation, as well as short-term memory deficits. And I think it's important to kind of think about short-term memory is passive memory. It's not things that we commit to our permanent sort of memory. It's actually a good example is remembering where we parked in the Meyer parking lot. We don't always get the same parking spot, so it behooves us to pay attention to what row we're in and the surroundings that we're in. Swallowing also becomes affected with Parkinson's disease. What we know is that approximately 1 million people are diagnosed with Parkinson's annually. And of those people, 90% will eventually present with swallowing disorders sometime throughout the course of the progression of it. So many of us experience some negative changes with regard to Parkinson's. And some of those, in fact, the things that I have listed are actually things that patients have told me that are happening to them because of Parkinson's. They feel like they're becoming socially isolated. They avoid conversation. They're embarrassed to speak because their voice is too low, or people can't hear them, or people are having difficulty understanding them. And then what happens is they're actually becoming frustrated when they're speaking. Some of my patients tell me that they become confused during the course of conversation because they're having difficulty following the entire conversation. And oftentimes, you know, spouses and family members, we observe you guys withdrawing from communication, and you know, it's actually, you can pick up the cues as you know, the patient will be saying, well, never mind, forget it, or it wasn't important. And that's a subtle cue to the other listeners that that patient is starting to withdraw from communication because it's becoming difficult. We also see weight loss in our patients as well, because the oromotor musculature is becoming affected, so it's becoming increasingly difficult to chew food, to manipulate food. We're becoming tired during the course of intake. So when something isn't pleasurable, we avoid it, and that results in weight loss. We also see pneumonia happening with our patients, and this isn't a viral pneumonia. This is a bacterial pneumonia because food is entering the airway. Food or drink can be entering the airway. And when you think about it, your airway or the lungs, they're a sterile chamber, so we don't want anything in there. So unfortunately, the patient is hospitalized with pneumonia. So I spoke about some of the communication difficulties that patients encounter, but these are some strategies that I think can enhance and could possibly ease communication skills for people. If you remember to speak slowly and emphasize each sound in an effort to maintain intelligibility. Speech is fine motor movement. So if your tongue is a fraction off at a certain location in your mouth, it will begin to sound sloppy. And that being said, musculature becomes tired, and when it becomes tired, it doesn't hit like it should. So again, your speech will become slower and sloppier. I always recommend to my patients inhale prior to speaking because it will help to increase the volume of your voice. When we inhale, that actually pulls your vocal cords closer together to the midline and creates a better vibratory response. Always make sure you have the listener's attention before you're speaking. And for patients that have difficulty with word finding, use word substitutions. Don't get caught up on just having to have a certain word. If the word exhausted isn't coming to you, the word tired means entirely the same, or the word big means the same for large. If you're unable to do word substitutions, I tell patients, then you know what, try and give as vivid of a description as you possibly can to put the listener into the same sort of idea or concept that you're trying to convey. I always recommend that you use predictable words and phrases because these are familiar to us and they're automatically part of our vocabulary. I have positioning yourself closer to the listener, and while this may not be easy to do in a world with COVID, you could probably do this in your own home. So if you position yourself closer to the listener, it's going to be easier on you. Paraphrase information. I tell my patients to do this just to make sure that you've understood the message. If you haven't, most generally, your communication partner is going to paraphrase the information back to you and ensure that you have all of the information that you were lacking. If you have a hearing loss, have it evaluated by an audiologist and use your hearing aids if you need to. Often it's difficult to discern, does a patient have a hearing impairment or is the patient actually having a processing issue? And the two are completely different because hearing impairments we can diagnose and we can actually fit the person for amplification, and then they're able to readily actually engage in conversation. But if hearing is completely intact and we're still having difficulty understanding messages, that's actually a processing deficit, and that's a whole different arena. When needing clarification, repeat back the part of the message that you did understand and ask only for the information you didn't get. So you don't want to get overloaded with information. You just need the portion of the message that you misunderstood. I also recommend that you minimize environmental distractions such as background noise and excessive movement in the background because that can be deterrent to attention. So for a lot of us, we watch our family member with Parkinson's or our friends, and we see them kind of backing out of conversations. And sometimes we can create a segue or a pause for your family member or your friend to join in the conversation. And it kind of lets them jump in because conversation occurs quickly. So sometimes we're not processing as quickly as we should, but if we give a little bit of a segue, that can be helpful. And a couple of examples are, honey, tell them what we saw in the backyard last night, or what did you think about the Lions game last night? Letter boards can also be beneficial to help decrease the rate of speech for those individuals that are speaking too quickly. And what this really amounts to is the person is going to point to the first letter of each word as they say it. So in turn, what this does, it actually is forcing the person to pre-plan their message in their head. And then they're going, as they're conveying it, they are pointing to the first word, or I'm sorry, the first letter of each word as they say it. Now, in all likelihood, this isn't something that you would probably do in public, but you could do it at home with your family members just to kind of start setting the stage as to how you need to slow down. We also know that metronome devices can be effective in decreasing the rate of speech. And we use these with patients that stutter, but when persons with Parkinson's are actually speaking too fast, it actually sounds like they are having disfluencies. So what the metronome does is it actually sets a rhythm for the person, and you can mirror your rhythm of speech with the metronome. We also have delayed auditory feedback, which can also be a successful approach to decreasing the rate of one's speech. What this involves is the use of a microphone that's placed in the ear, and it allows the speaker to hear themselves at a fraction of a second later. So it's actually, you're hearing yourself in lag time, which causes you to slow down. So I mentioned earlier that numerous patients with Parkinson's encounter swallowing difficulties. And how do we know that this is happening? Well, if we have leakage of food or liquids from our mouth, if we're having chewing problems, if it's taking us longer to eat than it used to, or if food is moving slowly through the throat and esophagus, those can be signals that the oral musculature and the pharyngeal musculature just isn't working as it once did. Oftentimes patients report that they feel like food is sticking in their throat, or that they're having difficulty taking medications. And you know, sometimes when you have food sticking in your throat, there are a couple of pockets that are in your throat. One's called a vallecula and the other is a piriform sinus. And what can happen is food can puddle in those two pockets. And so it's not your imagination, because 90% of the time we do a video fluoroscopy, and you know what, sure enough, the patient has stuff that in those pockets. So what do? We can, sometimes we can flush that out with thin liquids or subsequent swallows. A lot of times when we're having difficulty taking medications, I will tell patients, reduce the number of pills that you're taking at a time. So instead of taking 6 pills at a time, take 1 or 2 at a time. You can try presenting them in applesauce or pudding or even yogurt. Those substances have increased viscosity, so it forces you to actually create more of a cohesive bolus with the pills, and then you can actually engage in a harder swallow, which results in clearing. Coughing or choking when eating. You know, when you think about it, we all cough and we all choke, and it happens intermittently or every once in a while, and that's normal. But when we are coughing and choking consistently, or if you're coughing and choking you know, all the time at the end of a meal, or when you're consuming a thin liquid, then that's indicative that something larger is going on, and I think you need to contact the physician. I always say that persistent difficulty with eating and drinking definitely requires a visit to your physician to ensure that you're not aspirating. So in the event that we're having some of these swallowing issues going on, what on earth are we supposed to do? So some of the things that I tell my patients to do is to make sure that you're sitting upright when you're eating. There's no semi-reclined, laying back in the lazy boy. What you want to do is you want to let gravity actually pull the food into the abdomen. You want to let it pull the food down into your pharynx and then into the abdomen. You also want to ensure that you're well rested before you even begin to eat. So if you're tired out, give yourself a break. Take small bites and eat slowly, because keep in mind, your musculature may not be working as proficiently as it once did. And oftentimes the musculature gets fatigued, so it starts moving slower. And if we're still trying to consume as we did at the beginning of the meal, we are literally setting ourselves up for failure. I recommend that patients consume foods higher in liquid content, such as casserole items, or even adding extra moisture to items such as gravy or broth or mayonnaise. This actually just makes it easier for you guys to manipulate the food in your mouth and propel it from the front of your mouth to the back of your mouth. And I tell patients, you know, think about consistencies. A piece of meatloaf, even though you may or may not like meatloaf, think about the consistency of it. A piece of meatloaf is going to be easier to manipulate than a piece of steak or a dry piece of chicken breast. So you always want to think about what's going to save your strength and what's going to be the easiest and safest thing for you to eat. I also recommend consuming several small meals throughout the course of the day so that you avoid fatigue with your tongue and your lips. You know, we want to make sure that we're getting proper hydration and nutrition, but you know, sometimes it's just not safe to consume 3 meals a day. Sometimes we need to revert to consuming 8 or 9 meals a day to get in those 2,000 calories or 1,800 calories or whatever amount of calories you're supposed to be getting. I also recommend that you soft cook vegetables. You can add butter or olive oil. You can choose moist, tender cuts of meats. Again, they're going to be easier to manipulate in your mouth and actually move from the front to the back of the mouth. When you are noticing that you're having some fatigue and issues with eating, I always tell patients avoid foods that are dry, crunchy, or break up into small pieces like nuts, raw vegetables, ground beef, or popcorn, because what can happen is these things can break away and actually pocket in those areas that I was speaking of, the vallecula and the piriform sinuses, and sometimes they can get dumped into your airway. Other times those things can kind of lay around in your gum line and they can mix with your saliva, and the next thing you know, the saliva is going over the back of the base of your tongue with the piece of ground beef in it, and we're choking. And at that point, we're not just choking on saliva, now we've got a protein that's actually been channeled into your airway. I also recommend to my patients that they stay sitting upright for at least 40 minutes to an hour after eating to avoid the potential for aspiration. Research has shown us that after eating, if you lay down, gravity can have the reverse effect. And what it can do is food and things can pool up and then actually flow over into your airway. So be safe, stay up after you're eating for at least 40 minutes to an hour. Let the intelligibility of your speech be your guide. And you know, some patients say, well, what does that mean? What I mean is when you're talking, listen to yourself. If you sound slow and your speech is sloppy sounding, that is an indication that your tongue and your lips are tired. And those are 2 of the main players when you're talking, but they're also 2 of the main structures when you're eating. So if those structures are moving slower and your speech sounds draggy, then you know what, be careful when you're eating because those structures are fatigued. So you want to choose something that's going to be easy to manipulate. And again, if swallowing issues persist or worsen, contact your physician. I always tell patients, err on the side of caution. You're not being a hypochondriac by going in and actually having a baseline study to see where you're at. Because really what it lets us know is this is where you're at in 2020, and then maybe in 2022 you notice something's going on. So you know what? Now we've got a baseline study to compare that to, and we can see either things have gotten a little bit worse, or you know what, you've been doing something right and we're actually maintaining skills. So I mentioned in the beginning that I also wanted to discuss 2 evidence-based voice programs because oftentimes vocal quality is affected as a result of Parkinson's. And the 2 programs that we have available are called the Lee Silverman Voice Therapy Program, which is otherwise known as LSVT Loud. And we also have the Parkinson's Voice Project, otherwise known as Speak Out. These programs are very similar in that both programs are research driven. They're usually covered by Medicare. However, they both require intense effort and ongoing practice. Both programs recommend periodic tune-ups in an effort to maintain your strong vocal quality. So let's kind of delve into a little bit as to what LSVT Loud is. It is an intensive structured program. It has been shown to have long-term effectiveness with regard to increasing vocal quality. The focus is on healthy vocal loudness via sensory recalibration. So what on earth does all that mean? Well, what it means is that when you come in and you're going to do LSVT Loud, you're not just yelling, because yelling is vocally abusive. So what we want to do is we want to use healthy vocal loudness, and we achieve that by using diaphragmatic breathing in an effort to get loud. The sensory recalibration component comes from the fact that we have daily homework that you do with this particular program. And what that program, that homework in that program is designed to do is to provide you with some ear training for what a healthy, loud voice sounds like. And the goal, obviously, is to use healthy, louder vocal quality automatically during the course of daily communication. This program has also been effective in improving swallowing function in patients with Parkinson's disease as well. So the Speak Out or Speak with Intent program is very similar to LSVT Loud in that it is structured, and it has demonstrated long-term effectiveness for improving vocal intensity. But with this program, the focus is on converting speech from an automatic act to an intentional act. And what that really amounts to is the automatic act is your actual automatic or habitual loudness level. So most generally that habitual loudness level, when we start looking at it on a decibel meter, it sometimes ranges very low into the 50s and sometimes into the 40s. What we want to do is move away from that habitual loudness to an intentional loudness, which is where it comes to speaking with intent. And when we speak with intent, we actually increase our breathing, our breath support, and we are able to project the vocal quality. And again, the goal is to enhance an individual's ability to communicate using purposeful vocal intensity. And once again, much like LSVT, this program has been effective in increasing swallowing function with patients with Parkinson's disease. So how do we cope with Parkinson's disease? I always recommend that my patients be proactive, stay abreast of the information that's out there. I think the internet is a wonderful source. I also recommend that patients enroll in speech therapy if they think that they're having changes in their communication or swallowing, because it's easier for us as therapists to help you guys maintain skill levels rather than, when we wait and then our skills become deficit. Now we're trying to actually rehabilitate and get you back to a level. So hopefully we can get you when you're at a functional level and then continually enhance those skills. I also recommend that we stay active and exercise daily. More and more research is coming out, and we're seeing that there is a strong link between cognition and physical activity. What we are learning is that physical activity actually helps to enhance the neurotransmitters in our brain that are responsible for cognition, which is dopamine, norepinephrine, acetylcholine, and serotonin. So I always tell my patients, stay as active as you can within safety, because you're going to do yourself a big favor with regard to cognition. Socialize and keep connected to friends and family. I mean, they're a great source of support, as I'm sure you guys are well aware of. Joining a support group. I think it's real important that patients with Parkinson's do join a support group, because you know what, I can see patients all day long with Parkinson's, but I have no clue what you guys are going through because I don't have Parkinson's. But I will bet you that the people that are involved in your support group, they can completely relate to what you're going through. So I think it helps to provide you with the concept that you're not alone in this journey. Conclusions. Early intervention can preserve current levels of function. So I strongly urge you, if you think that things are just kind of dwindling, get enrolled in a program. Early intervention can reduce the symptoms of Parkinson's, and it can also assist with the creation of home treatment programs that can increase the likelihood of maintaining your active lifestyle. At this time, I would like to conclude my portion of this presentation. I hope I provided you with some useful information, and I actually would like to thank you for attending and participating, and I'd be happy to answer any questions that you guys might have.
Laura, thank you so much. That was really helpful. If you have a question, you have the capability of unmuting yourself. So just, if you see a microphone somewhere on your screen, there's probably a red line through it. click on it, or if you're just using your cell phone, click on that line and it will unmute yourself. Or you could also type questions into the chat button that's at the bottom. On mine, it's at the bottom of the screen. You can type a question in there and we can ask Laura that way.
It says that it's recording.
Okay, go ahead.
The screen says, it's got a red thing that says that it's recording. Where can I pick up the recording?
Yes, we did record it. I'm going to put, we post all of these programs on our website, on our YouTube channel. I'm going to put the address to our YouTube channel in the chat button right now, okay?
Thank you very much, Laura.
You're welcome. It's my pleasure.
Laura,
Yes.
my name is Ann. I live out in Clarkston.
Uh-huh.
My question is, between LSVT Loud and Speak Out, do you have a preference, or do you see that one is better for some people than others?
You know, honestly, I don't have a preference. I think they're very similar in nature. I think it just depends on the patient. I think both of them can be customized to fit a person's individual needs. And I mean, at the end of the day, they're both trying to enhance your intensity. What I do know is that the Speak Out program does have a cognitive component to it. LSVT Loud does not have that. But I mean, I've actually, you know, have addressed the cognitive component in conjunction with LSVT Loud. So it just, either program, I think as long as you're getting help and it's enhancing your vocal quality, I think either program is great.
Okay, thank you.
We have another question?
Okay, Laura, it's Ann again.
Yes.
Okay, so where do we find these programs being offered? You said you're with Ascension Genesis Rehab. So for you, it's there, correct?
Correct. Actually, now I know with LSVT Loud, you can, if you're interested in like voice programs, you can actually go to those actual sites, and they have a registry, and it would show you persons that would be in the Clarkston area.
Got it.
So you might be able to find somebody closer.
Okay. And you're located where?
I'm in Grand Blanc. I'm on Hollywood.
Grand Blanc. Okay.
I'm just adjacent to the Ascension Hospital.
I
So
know.
Orlando would be a little too far.
You know what? Florida has really strong Parkinson organizations. So if you go on the Parkinson Voice Project website and then just type in the zip code or the area that you are in Orlando, or the LSVT, either one of them, you can find a therapist that way.
All right, thank you.
And for those of you, Laura works with Angie Ludwa, who we all know really well, the physical therapist who teaches all of our exercise classes.
Oh, good news. Okay.
You work with Angie, correct, Laura?
Yes, yes, we work in the same building. Yep.
Yeah.
Oh, very nice. Okay.
Do we have another question?
Well, Laura, is the Speak Out program also offered at your facility, or only the LSVT program?
I only do the LSVT program. So I mean, if you're interested in the Speak Out program, yeah, I would tell you to go ahead and try and Google it, put it into your search engine, and then actually see who's closest in the registry to you.
Got it. And are you doing virtual training with the LSVT Loud because of the COVID, or are you actually meeting with people?
No, I'm actually meeting with people face to face. We're having people wear face masks. I mean, obviously, when I'm doing therapy, I will generally have the patient take the face mask off, but I'm fully masked. And oftentimes I'm actually wearing a face shield because sometimes you guys need to see my face in order to what I'm doing.
Okay, thanks.
Any other questions?
Hi, Laura.
Hi.
Hi, my name is Princess Cooper. My husband was diagnosed with Parkinson's June of 2019, and it's progressing so fast. Then now he's diagnosed with FTD, frontal temporal dementia. So I have to move him now to an assisted living because he kept having multiple falls at home. It's so difficult for us for the past 2 years.
Yeah, and you know what? Since sometimes that happens, you know, we all know that the disease progresses differently with everyone. But you know, it's trying to keep the patient safe, and you know, it's hard. It's very tough.
Yeah, and every time I visit him, it's like he want to come home with me. He will be crying. He want to come back home. Oh,
Yeah,
boy.
that's hard. It is very hard. I can only imagine.
Yeah. Well, thank you so much for this program. Thank you so much.
You're more than
I was
welcome.
able to learn so many things because now we're having very difficulty eating and swallowing. It takes like 2 hours to eat just a small sandwich.
Yeah. You know, and honestly, I always say slow and steady wins the race with eating. I would rather have somebody go slow and be safe with eating than to try and rush through. And you may even want to check with the speech therapist that's there at the assisted living facility if they have one.
Okay.
They may even want to do a diet modification with him, or even do some kind of like video fluoroscopy, which is a radiographic procedure where we can actually see what's going on and how the food is transiting.
Okay. All right. Thank you so much.
You're welcome.
I had a swallowing test and it said everything's fine, but I choke on dry meats and it takes me an hour to eat.
Wow.
You know, but I would tell you, I mean, I guess I would ask myself, are you tired out when you're starting to eat? Make sure your musculature is well rested. It's kind of, you know, and try and eat things that are going to be simple. You want to literally preserve your strength. So sometimes you have to eat things that are a little that are easier to eat. And take your time. I mean, if it takes you an hour, at least you're still eating. And that's a good thing.
Okay. Do we have any other questions? A few of you have asked about this voice project. I do want to let you know that Andrews University, they're located in St. Joseph, Michigan, on the west side of the state. They received a grant to provide a 12-week session of the voice training for people with Parkinson's, and it's free of charge. I've sent out some information about it if you're interested. It's 12 sessions over 4 weeks, so it's 3 sessions a week, and it's all done by Zoom, and it's conducted by speech and language pathology students in their university program, but supervised by the professors. So if you're interested in that, just send me a quick email. I'm going to put my email up here, and I will send you the information. We have sent out some info on it.
I'm actually participating in it.
Oh, you are? Okay. Who's that? Who just said that?
Sheila.
Sheila? Oh, hey, Sheila, how are you? You're doing it good. Are you enjoying it?
Yes, I am, very much so.
Oh, good. I'm glad you're taking advantage of that. Okay, any other questions?
Hey, Sue, I just have a comment. I actually had my throat stretched 2 years ago because my swallowing got so bad, and it did help significantly. They did an upper GI, and then they stretched my throat with a tapered cylinder.
Laura, is that a common treatment?
Not usually, but I mean, I've had patients, everyone's tissue is different. And I usually see that more so with my radiation patients, where we go in and we do an esophageal stretching. But, you know, if you're having difficulty like that and it just doesn't feel like things are transiting well, yeah, seeing a GI specialist is always pertinent, because sometimes people crop up with esophageal issues, and just doing a stretching like that can make a world of difference.
I've got a question. We have a few constituents that we deal with quite a bit, and they talk really fast to the point that it's almost hard to understand them, especially over the phone. Is there any, their volume is fine, it's just they talk so fast.
Yeah, that's when, that's for those things like delayed auditory feedback. I've used that with a couple of patients. And actually, you can access that through your smartphone. There are different apps for delayed auditory feedback, and they're not that costly. So what they can do is they access the app, allow the app to have access to your microphone, and then using your Bluetooth, you can actually put that up close to your ear, or even like just using some of the different things that iPhone offers, so that they can actually hear themselves, and it slows them down. That's probably one of the most hidden ones, you know, that you can use. The letterboard is very overt. Patients, you know, they feel like it's embarrassing. Metronome is something else that they can use, but that takes a little bit of practice. But I've seen decent results with using delayed auditory feedback. And you can actually change the feedback throughout the course, because sometimes, you know, we're having a good day and we don't need to have that as great a lag time as we do when we're having an off day and we're speaking way too fast. We might need to increase the lag time. And then there are also products on the market, if you just put it into the search engine online. Those can be a little pricey, but the apps through the phone, that's a good avenue just to try and see if it's even something that you're interested in.
Okay, it's called Delayed Auditory Feedback App.
Yeah, well, actually, yes, you can just type that into the like the little search bar, into the app section, or it also goes by DAF, D as in dog, A as in apple, F as in Frank.
Okay. Thank you.
You're welcome.
Okay, folks, any other questions?
Mary Sue, this is Ann again. The only thing I would wonder about with that St. Andrews University program is, if you go through that, are you allowed to participate in the Loud Crowd weekly support group?
Yes, that's the second part of that. After you finish the 12 session training, then they want you to participate in the Loud Crowd.
But can you participate in our local one versus the St. Joe's one?
Yeah.
Okay.
Their goal is to help you.
I see.
They said they got a grant from the Parkinson Voice Project, and they asked for our help in recruiting patients. It's all free of charge. We sent a pretty detailed email about it, maybe about 3 or 4 weeks ago, but I'll send it out again. Okay.
I appreciate that. Okay.
All right. Any other questions?
No question.
No.
Well, Laura, I thank you so much. I learned quite a bit. This was really good practical knowledge. Thank you.
You're more than welcome, anytime.
Yeah, and again, Laura is with Ascension Genesis up in Grand Blanc. If you're up in that area, they've got a great program up there. Angie and the occupational therapist will be speaking next week, and this is part of our Living with Parkinson's series. So with that, I'm going to say good afternoon and let you all get on with the rest of your day. I think it's nice out.
Getting cloudy, getting cloudy.
Is it cloudy? Is it? Okay. All right. So, y'all.
Thanks, Laura.
You're welcome. You're welcome.
Say hi to Angie.
I sure will.
Okay. Can I add this? My husband, who has Parkinson's, wrote this book, Matters of the Heart, and it's available on Amazon.ca.
Okay.
Okay.
Yeah.
Very
thank
good.
you.
Thank you.
All right.